Hi, I'm Dr. Vybhav Deraje. I'm a plastic surgeon at Aesthetica Veda, Bangalore. This is going to be a slightly longish video. I'm going to talk about step-by-step approach for a tummy tuck surgery that we do. Now, a tummy tuck surgery is where we take out all the fat, cut out the excess skin and tighten your muscles of the belly. So this is a surgery that we do under general anesthesia. So once you have been given general anesthesia, we place you on the operating table and do some liposuction to start with. Now this liposuction, how we do is a total 360-degree liposuction of your abdomen, where we do liposuction of the back where there is a lot of fat too, and the liposuction in the front in some strategic areas. Once the liposuction is done, we make a cut in the crease of your groin. If you have a cesarean section scar, we usually use the same scar and extend it on both directions. Once we make this cut, we go inside, we dissect all the skin off your muscles. Now, after pregnancy, you can have the looseness of the rectus muscle or your abdominal muscle. We usually tighten this using some non-absorbable stitches completely so that the shape of your abdomen is absolutely flat. Once the muscle tightening is done, we cut out all the excess skin that is there, which is loose and dangling in your abdomen. We relocate your belly button and we create a beautiful new belly button for you during the surgery. And then we do the stitching of the scar, which usually comes down inside your panty line so that there are no external scars visible after abdominoplasty. Usually, if you undergo an abdominoplasty, you will have to stay in the hospital for 2 to 3 days, usually, depending upon your comfort level and pain tolerance level. You will be given enough painkillers to make you feel comfortable during the stay in the hospital, and also some painkillers and antibiotics once you are discharged from the hospital. You will need to be extremely careful while walking around. You will have to bend your abdomen and walk for the first few days so that you don't rip open your stitches. You will not be allowed at least for 6 weeks to do any sort of strenuous exercises. So these are some of the drawbacks of abdominoplasty, where you are restricted for a while, especially for 1 week you will need some help at home, and for 6 weeks you will not be able to do any physical activity. But this will be balanced by the benefits of the tummy tuck that you get in the long term. You will be much more active because you have lost all your fat, you've lost all your dangling skin, and your muscle of the abdomen is absolutely tight and strong. We have seen patients who have undergone tummy tuck going for long marathon runs after their procedure. They feel extremely confident about their body image, the anxiety levels decrease, and they are able to face their life with much more vigor after a tummy tuck surgery.